to Kissington Magazine podcast. We're here today with a wonderful guest to talk about something we haven't talked about yet on this podcast. So welcome, Stephanie.
Hi, thank you. I'm Dr. Stephanie Zwonitzer. I am a nurse practitioner. I have my Doctor of Nursing practice degree, so I'm working in urology and sexual health at this time.
Nice. So
Yeah.
tell us more about that. What led you
Yes.
there?
I actually was in a primary care position and I just really was unhappy with who I was working for, not necessarily what I was doing. And so just putting my application out there to all different things. And I had a former colleague that worked for the company that I work for and said, "Oh, you're going to love this. It fits your personality. Go for it." And so I did. I applied, got the job, and it's definitely my fit. I love urology, most parts of urology, but my favorite part is the sexual medicine. I help men with erections, with premature ejaculation or delayed ejaculation, sometimes with chronic pelvic pain that can interfere with sex. I help women with pain with sex, vaginal dryness, prolapsing vaginal issues, and overactive bladder and recurrent UTIs, which sometimes do stem from sex. So a lot of different variety throughout my day, but all, related to and surrounding sex.
Do you find that the patients that you work with are comfortable talking to you about this?
Usually, some of the men are a little bit more timid.
Mm,
I'm not sure if it's because I'm a female or just because men have a hard time admitting when they have issues sometimes, and
mm.
they feel like maybe they aren't supposed to talk about it because they're not supposed to have these problems, right? They're supposed to be this strong man who can get erections whenever he wants and
Right.
all of that. And so sometimes I find that they have more difficulty talking to me. But what I've done is I just have an erection poster up in all in my exam rooms. And so a lot of times they'll just point at it and say, "Hey, can we talk about that?" And then we're able to get into that. But really, I try and break the ice. I try and talk to them, very open and honestly. And by the end of the appointment, they're telling me pretty much anything because we've developed that rapport. I'm very happy that I've been able to kind of find those ice-breaking things that allow them to open up to me.
Nice. That's great. Do
Yeah.
you have what's the most common thing that you deal with, would you say?
Yeah, for men, it's erectile dysfunction. It's just so prevalent. We're seeing a lot more of it in the 20s and 30s now, I think, than we
Mm-hmm.
have in the past. And I think a lot of that comes from how accessible pornography is.
Mm-hmm.
And just that once young men, get used to a certain type of pornography and masturbating in a certain way, when they have partnered sex, they have more difficulty with that. So one of the things I always ask them is when you masturbate, are you okay? Or when you have intercourse, are you okay? Or neither time, and kind of differentiate where their problem is. If it works physiologically when you masturbate, it should work physiologically with partnered sex. And so we kind of try and pull that apart. As you get older, there's more things involved like blood flow, which is the number one issue, obviously, because we need blood to get to the penis to get an erection.
Right.
But also, they're on blood pressure medicines, they're on mental health medications, they're maybe overweight or maybe had a smoking history. There's so many different things that go into erections. And so it's kind of teasing apart what ways we can help them for that. I would say for my women, the most common is recurrent UTIs.
Yeah.
Yeah.
Do you see a
Especially
lot of women?
postmenopausal. Yeah, I do. I say
Yeah.
my practice is about 50-50 men to women.
Oh, yeah.
Yeah. Yep. Yeah, a lot of times, postmenopausal, we stop making estrogen.
Right.
And one of the things, the areas that estrogen is so important for is our entire vulvar area. And
Mhm.
so your vagina, your urethra, your labias, all of those things get thinner and more easily getting torn, more easily getting infected, causing things like frequency and urgency of urination that you wouldn't necessarily think is related to your estrogen level.
Mm.
Recurrent UTIs in women, it's a huge issue postmenopausal because it's so much more easy for us to get infections. And so that's a big issue for my ladies, and they come in a lot for that. And the first thing we do is vaginal estrogen because it's such an important thing, and it's very, very safe. We have research study after research study showing that the topical estrogen is very safe. It doesn't increase your risks of cancer and things like that. There will be some oncologists that say, like, hey, your patient is in active breast cancer treatment or active endometrial treatment. So we're not going to do the estrogen at this time, but when they're done, we can, or something like that. But for the most part, I always have my patients ask their oncologist if it's okay. And I would say I only have maybe two or three patients out of all of my ladies that have been told they need to not use it. So it's very, very safe and it replaces that estrogen in that area. So you have beefier tissues, you've got better lubrication, more blood flow. So the fighter cells are going there and fighting off infection. The bladder lining gets thicker again, so you don't have as much frequency and urgency. So that's a big one for my ladies, and we're really good at treating it.
You find somebody said that coffee causes some of the struggle. Is that true?
Yeah, absolutely,
Yeah,
especially caffeinated coffee. Now,
yeah.
coffee in and of itself, because of its acidity, is irritative to the bladder.
Um,
But then you put caffeine in it, which is also irritative to the bladder and is a diuretic. So now you're making extra pee and you're going to the bathroom, you're having all this frequency and urgency, and some people even get burning just from drinking coffee.
wow. Yeah,
Yeah.
that I didn't know. Wow.
Yep, it's one of the first things I tell people to cut back on when they come in, men or women that have frequency and urgency issues. Cut back on the caffeine and the alcohol. Those both really irritate the bladder.
Yeah.
Hmm.
Um, so do you find that they do what you recommend? Or do you have,
Sometimes.
yeah,
Times.
yeah,
Yeah, I think, it depends on how motivated they are. If it's just kind of an annoyance, but it's not really that bothersome, they may or may not take what I say to heart, or they might cut back a little bit, but still enjoy those types of beverages. But, teachers, nurses, truck drivers, people who can't pee at the drop of a hat at work,
right,
they're the ones that are most likely to make the changes because their job depends on them not being in the bathroom every 20 minutes.
right.
Yeah.
What else contributes to that people are surprised to learn about?
Carbonated beverages.
Oh,
Just the carbonation itself can be irritative to that.
right,
And, spicy foods, chocolate, artificial sweeteners are really irritative to the bladder. So, you got to be careful when you're having a Diet Coke. You've got the caffeine, the carbonation, and the artificial sweetener all at once. So,
yeah,
there's some pretty nasty stuff out there that our bladder does not like.
right. When
Yeah.
you coaching or do a recommendation for the erectile dysfunction for the 20 and 30 somethings,
Hmm.
are you finding that they're not as sexually active?
Yeah, I am actually. It's very interesting. I was actually had a patient on Friday this week who was in his early 30s and was like, "Yeah, I mean, I have, his girlfriend's long distance, so when they're together, they have sex, but otherwise, he only masturbates once a week or every other week." And to me, that's just so different than the generation I grew up with. And our men were masturbating, a couple times a day, I think, when we were teenagers and in our 20s and 30s and stuff. So, it's definitely a difference that way. Have you seen that also?
Yeah, yeah, I
Yeah.
have my practice, and they seem to somewhere something happened that sex is not as the go-to that was, at one time in the 2030s. It used to
Yeah.
be your driving force, so to speak.
Yeah,
Uh,
absolutely.
yeah, and it seems to wane for some reason, and I'm like, okay, where's the hiccup in that? Because
Yeah,
your body, our physiological bodies are not changing, meaning
right,
the need is still there. The need to reproduce is still there.
right.
It just happens, but they're able to push it aside. And I'm like,
Yeah,
who told you to push it aside? And where did that
right.
happen? Yeah,
Right. No, I totally agree. It's interesting. And, that generation is changing everything. They're drinking less than other generations.
right.
They're smoking less, but nicotine products, but more weed. There's a whole different generation coming through with just a lot of changes on views on many things. But sex is definitely one of them.
Yeah,
I think I have found that they prioritize their careers and advancements in the personal areas and professional more so than relationship and sex.
yeah.
People they're getting married later. They're not as, like you said, motivated by sex and procreation. And
Mhm.
so, people are having babies later in life and things like that. So yeah, I would say absolutely I've seen a decline in that.
Right. It'd be interesting to see more studies on that. Like, where's the hiccup? With that.
Right.
Is it based on the state? Is it based on education? Is it what is it that it really got that going? And
Yeah.
and it's still happening because it's not you and I talking about it now. It's been happening for several years.
Right.
So I'm like, why? I mean, I'm
Yeah.
all for protective sex. I'm
Right.
all for, not having kids until you're ready. And same with marriage. Marriage should only happen when you're ready, not just because all your friends are doing it, therefore I should
Right.
get married.
Right.
But what stats, of course I'm biased, but stats is one of the best parts of life.
Absolutely.
Especially when it's done with consent and it's done with somebody that understands what you want and don't want and all that fun stuff. But the body's ability to, have pleasure from sex, whether you have an orgasm or you're just being touched.
Right.
That's awesome. It's a great feeling,
It is.
when you're able to enjoy it under the right circumstance. So
Yeah.
I'm just amazed. And actually, a little flabbergasted that the 20, 30 somethings can ignore that part of their body. You know,
Yeah.
now granted, I was taught that that is the only thing in the body that there's a switch.
Hmm.
Everything else is automatic. You can't
Yeah.
turn off your heart. You can't turn off your breathing. Sex is the same as breathing.
Yeah.
However, it's the only thing we can go, no, and turn it
Yeah.
off.
Isn't that
So,
interesting?
yeah. So,
Yeah. And you can really see that in relationships that aren't doing well for whatever reason. And that's one of the first things that goes is the sex life.
right. Yeah.
Mm-hmm.
And then
Yeah.
it's a telltale sign, and people don't realize that they don't, But yeah, that goes back to the education. Who teaches you that? Who teaches you to realize, wait a minute, we aren't having sex. I'm not being pleased. You're not being pleased. We need to talk about this. And who sits you down and says,
Right.
with your partner, and when you realize, you just don't learn that. You don't learn that in
Right.
sex ed either.
Right. Yeah.
Yes, you can read a book on it, but
Right.
even some books don't talk about it in that
Mm-hmm.
way.
Well, and a lot of clinicians don't ask the right questions. I
Right,
know that's a focus that I have, is that I don't just ask about your erection quality. I also ask about your orgasms and your just sexual life fulfillment. For women, I'm asking, are you well lubricated? Are you achieving orgasm? Are you having pain with sex? Trying to get the whole gamut of their sex life. Are you able to climax by yourself or with a partner or both? And kind of helping them get to that next phase because a lot of clinicians aren't going to ask those questions. And I'm already working in a, part of the body that we don't talk about a lot. And so we're already opening doors of conversations just by coming into my office. And
Right.
so I like that I have that opportunity to pull these apart, and then I can send to sex therapists. I can send to pelvic floor physical therapy. I can deal with issues that are within my scope in the office. And we can really get more of a holistic care for these patients because a guy can come in and talk to me till he's blue in the face that, it's just his erections, but he's still attracted to his wife. And then you find out he's on diabetic medication, he's on hypertension medication. He's probably not going to get an erection, even if I prayed over him every day, every day, every day. So
Right.
we get him on some medicine, but I'm only working with him in that moment. So until he tells me, well, my wife just tells me no all the time, or I can only have sex on Sundays because that's what works with my wife, or my wife is having pain, she just went through menopause. What can I do to help her? Or something like that. If I don't know those issues or ask the right questions, I'm not helping them fully, right? Just
Mhm.
because I got your erection better doesn't mean you're going to go home and have sex with your wife when she's in pain after menopause. And
Right.
so we need to have more of a, I can't tell you how many patients, husband or wife, that I'm like, oh, send your spouse in. I'll take care of them too. And
Yeah.
then we send them to sex therapists so they can work through the mental side of it and any resentment that maybe has built up or, different libidos and things like that and kind of work through, the more psychological side of things as well.
But do you say that when you prescribe the ED meds? Do you say that this is one component, this is only helping with one component of the ED?
Absolutely.
Uh-huh.
Absolutely. And a
Yeah.
lot of guys will come in, with ejaculation issues, either premature, they're coming way too quickly, they don't
Right.
want to come that quickly, or they have delayed ejaculation where they just really struggle to even get to the orgasm. But it'll say on their sheet they're coming in to talk about erections. And so that's kind of interesting too, is pulling apart those questions as to, well, it sounds like your erection is fine. So what's the actual issue here? Because it's not always about the erection. That is just one part of their sexual health. And so sometimes we need to, treat the premature ejaculation, the delayed ejaculation. And some of that I'm sending them to sexologists and sex therapists as well, because a lot of that can be psychological as well as physiological.
Right. Right.
Yeah.
Is that
Yeah.
like part of the reason Kiss and Tell magazine started was to help people have the conversation,
Hmm.
and keep the conversation going about it too. Because it's never just one conversation. It should be continuous. I mean, you don't have to talk about all day long, but be
No, you're
comfortable
absolutely right.
talking about it. So is that
Yeah.
part of the reason that you do the podcast? The
Yeah,
podcast
it
that
is.
you do?
So I have a podcast called Between the Sheets, and it's a sexual health and wellness podcast. And yeah, that's really what it is. At work, I still have to see general urology patients, so not everybody at work is a sexual problem. And I just find, the same purpose that you have in the Kiss and Tell magazine is there's just not enough quality education. Directories of sex professionals that can help with these issues. And so I started this podcast, and we've talked about a gamut of different things related to sexual health and sexuality. And it really allows me to kind of pull through some different topics that are considered taboo or aren't talked about as much, or to just talk about the fact that erections aren't all it is. Like we got to talk about all of it.
Right.
So yeah, it's been a really cool outlet for not only me, but for my listeners to have a source of quality education and conversation.
Is there any of the topics that you've done that even it makes you uncomfortable to talk about?
No, I've been in this long enough that at this point I'm comfortable talking about anything. But my son actually edits for me. He's 16. And so there's been a couple times where he's been like, "Mom, I can't believe you talked about that."
Yeah.
There's been a few things that have made him, a little uncomfortable, but I think I'm just so open, and I love the fact that there's such a variety in what people like, what people do, and just because something may or may not be for me personally, I'm still interested in learning about it because one person is not the only one who likes something.
Mhm.
or is interested in a certain thing. There's still going to be plenty of people. So I have had guests from an erotic novelist who we talked about how reading erotica for especially women, but men and women can be really pleasurable and can kind of get you in the mood if you struggle with that.
Mhm.
I had a Christian sexpert who came on and talked about the kind of holier than thou aspect of being raised. Don't have sex till you're married, but on that wedding night, honey, you better be a goddess, right? And kind of talking through that, I've had other urologists come on and talk about erections and Peyronie's disease, and I've had other sexologists come on. I've had some pelvic floor physical therapies. So we're really getting this variety of conversations on all the different aspects of sex because it is
Mhm.
so multifaceted.
Right. Cool.
Yeah. Yeah, it's been really
Is it-
fun. I've met some really neat people and gotten some really good conversations about topics on sex that I really hadn't thought I was going to talk about on a podcast. But it's led in some really great directions, and some of the episodes that I was unsure of what the reactions would be have gone over very well. So, there's just we're sponges, and this is one area of our life that we're not getting enough information on, and we just want to absorb what we can so we can have good relationships and good quality sex.
Mhm.
Yeah.
Yeah. Good quality sex. I'm all for that.
Yeah.
Yeah.
Yes, exactly.
I
Nobody
mean,
wants to have sex that's just laying there and not really doing much for you.
but, but especially if you've had a long-term partner.
Yes.
I mean, it might be
Yeah.
the first time when it becomes that, but if you've had a long-term partner, you're hoping that you should have worked out all the ins and outs, no pun
Yeah.
intended. So,
Right. Well,
um,
the other unique thing about what I do is, you know, sex toys and sexual wellness tools are much more accessible now. They are talked about more often. And I don't know that I have any of my girlfriends who don't have a vibrator or a dildo or something, but
right,
there are medical grade ones for medical issues. We Vibe makes some great ones that are specifically to help with pain in the perineum, either during or is during sex or just at any point in time, more of the prostate massage for some men, especially like post prostate cancer treatment where they're really trying to get things going again. There's different cock rings that can send information to your phone via Bluetooth about how many erections you're getting at night. So
yeah,
there's lots of different really cool products in the sexual wellness world now. And I get to talk to my patients about that too. Hey, you aren't limited to just Viagra or Cialis for your erections. You can use constriction rings, cock rings. You can use penis pumps. We can do injections. There's so many different things out there. And there's some that you can get with your FSA and your HSA because they're medical quality and there's research studies behind them. Like, I think that's so cool that we have research studies on sex toys. It's
yeah.
amazing.
We just need more research on the female side, more support on that. I mean,
Yeah, we
yeah,
definitely need more support
like,
on that. It's
mhm,
really interesting to see the benefits of pelvic floor physical therapy for my ladies and just the different tips and tricks from breathing and massage and relaxation that can really help relax those pelvic floor muscles so they can have more enjoyable sex.
right,
Yeah.
yeah, great, that's awesome.
Yeah.
Was there any one episode that you did that you like at the end of it, you're like, I can't believe I just had that conversation.
Yes. I had a lady come on and talk about kind of like polyamorous type relationships. And
Okay,
that's just really not something that I have dealt with in my life. I know
but
people that have had different lifestyle choices and things like that, but I am a very jealous and selfish person, and so I don't share well.
yeah,
Maybe I need to go back to kindergarten and learn that. And
yeah,
so that was really eye-opening for me and very interesting, but also not something that I expected going into this that I would be talking about and talking about with someone who is just so open about it and
yeah,
comfortable talking about it. Because that, again, is another part of sexuality that's hush hush and taboo, and let's not talk about that.
yeah. And thank you, I wanted to do a K&T plug because actually every year we do a seminar And
Hmm.
this year will be the third year we've done one. And on October 16th and 17th, we're doing one on kink and
Yeah.
I'm saying it well,
Polyamory.
polyamory, thank you.
Yeah.
Kink and polyamory, and we have 6 speakers, or we have 3 so far, we're still
Yeah.
inviting people. But yeah, and that's
Yeah,
what we're
that's very
talking about.
cool.
Yeah,
Yeah,
so,
it's interesting. And some people just absolutely love that. And they really feel fulfilled in a multi-person relationship. And
mhm,
so it's not something that I frown on or anything. It may not be for me, but
right.
I think it's really interesting to learn because I am so like selfish and not and jealous that it's so fascinating to me to talk to people who can just love multiple people and a mixture of relationships within that group of people. It's really fascinating.
Well, what's interesting too about that is you don't have to do the behavior to be turned on by the behavior, and
Agreed.
people don't realize that. It just
Yeah.
you don't have to be doing kink just to hear about kink.
Hmm.
It's enough to turn you on. So,
Yeah.
people forget that all the senses are involved in helping us feel pleasure. So.
Yes. Yeah, in fact, there's apps now that will read you erotic novels or
Mhm.
short erotic stories.
Yeah,
So you can hear the stimulus, you can read erotic novels. There's certainly pornography, which I try not to suggest too much. Not that there's something wrong with it, but because if you watch too much of it, you can have difficulties then when you're having partnered sex. But there's so many different ways and senses to get turned on and to be aroused. And women need more arousal time than men do in most
mm,
cases. As men get older, they might need a little bit more to get things going, but for the most part, women do. We need a little bit throughout the day to get us ready for tonight. And,
right,
finding these little things, sending the sexy texts, reading a little bit of erotica, or listening to a book on Audible on your way home from work, those things can all help you get in the mood.
right. Yeah, thank you. Thank you for
Yeah.
being here today.
Yeah. Thank you for
Yeah,
having me. What a pleasure.
it was a pleasure meeting with you.